My name is Greenwood. I am a patient of Modern Vascular. Came about 6 months ago, had the original appointment, found that I needed both legs, the veins cleaned, arteries cleaned. I was told all kinds of things that were going to happen, and I'm thinking if there's a 10% improvement, I'm all for it. I've had sore knees, incredibly sore feet and ankles, swelling. The discomfort was the biggest thing. And I have myoclonic jerks, which are restless leg on steroids. Other doctors that see me, you get pain pills, which are great temporarily. They told me that a lot of that would be cleared up, and I'm sitting here thinking 10% improvement's going to be super. Came in for the angiogram. Insurance companies decided that I was a go, so I came back and had the left leg done. And 2 weeks later, I came back for the right leg, but in between I went to my endocrinologist, and he's taking the pulse in my feet, and he checked the left foot, and checked the right foot, and I've been seeing him for a little over 2 years. He went back and checked the left foot again, and then checked the right foot. He looked at me and he said, "What has happened?" I said, "What's the matter?" And he said, "Oh no." He said, "The pulse in your left leg is probably 3 times stronger than your right." And I told him that I'd had the PAD surgery, modern vascular, or procedure on my left leg. He turned around, reached up on his shelf, and handed me one of their ads. He had one of the stand-up ads for the company. And I said, "That's them." And he said, "I refer people there all the time." And I said, "Well, you hadn't said anything." And he said, "You hadn't told me how bad your problem was." So he said, "I'll be curious to see after the other leg is done." So I went back about a week later. He was just thrilled. And my wife works at a hospital in Fort Worth that treats a number of patients that are in to have things removed, toes, feet, ankles. And I've seen them up to the knee. Very uncomfortable looking. And treating this as preventive medicine is a wonderful idea. I understand that there may be reoccurrence. I'm 65, but they said they check it every 6 months and they watch. So Dr. Pratt has been very informative, very helpful. He did all 3 of the procedures. But just personable and compassionate, delightful gentleman. All of the help here is great, both in the surgical area and the greening. The people who talk to you and explain to you what their series of tests and what have you are going to accomplish. And I'm thrilled. I have referred them to several people in my church, several of my neighbors, my brother. I can't recommend them enough. And if I had it to do over again, or if I do, I will be right back here. Once again, great procedures. The pain was minimal. The pain that it took for my body was substantial. And I can't say enough about them. They are absolutely marvelous. And I love service like that, any place. But they were great. The pain has gone from probably a 10 most of the time to maybe a 1 or a 2. When I first stand up, if I've been sitting too long, there's pain. But the use comes back almost immediately. With 1 or 2 steps, it just dissipates. So, very happy, and I highly recommend them.